Connor. Nice to meet you. My name is Sarah.
Hi, Sarah.
I'm going to be your occupational therapist during your stay.
Okay.
I see from your chart today that we're going to be working on bed mobility and using a walker to get to and from the bathroom.
Sounds good.
Yeah, so just to explain my role in your rehab process, I'm just going to be helping you do the things that you want and need to do and maybe relearn how to do some activities because your knee is still healing and you might have to do things a little bit differently for a while.
Okay.
Okay, awesome. So before we get started today, I'm just going to take your blood pressure, which is a measure of the force of the blood against your artery walls. And I just want to make sure that your heart is nice and healthy and everything looks good before we get you moving.
Of course.
Okay, perfect. So I'm just going to use this. Is this arm good?
Yep.
All right, I'm going to have you nice and relaxed. And I'm just going to palpate your bronchial artery. I'm going to use this device called a blood pressure monitor.
Okay.
Secure it to your arm. The stethoscope. You're just going to feel a little bit of pressure. Great. So I got a reading of 120 over 80 mmHg. The first number is your systolic pressure, which is the force of blood going into your heart, causing it to contract. And then the second reading is 80, which is also within the normal range. And that's going to be your diastolic, which is the force of the pressure of your blood in the arteries when your heart relaxes, so it's a little bit lower.
Sounds good.
But yeah, those are both within the normal range. So
Awesome.
So if you're ready, I guess we'll get started for today's session.
Okay, perfect.
Hi, Connor.
Hello.
How are we doing today?
Good, how are you?
Pretty good. So today, before we get started, I'm just going to use this device called a pulse oximeter to take a measure of the oxygen levels in your blood. I just want to make sure that you have enough oxygen to do everything that we're going to do today. I know shortness of breath has been an issue for you in the past, and I just want to make sure your O2 levels are within a good range before we get you going.
All right, sounds good.
Okay, so I'm just going to put this on your finger and leave it on, give it a few seconds, and then we'll hear a beep when it's ready. Okay, so it's at 97% SpO2, which is good. Anything really above 95% is pretty normal, so that's very good.
All right.
So now we'll just get started today.
Sounds good.
Hi, Connor.
Hi, Sarah.
How are you doing today?
Doing well, how are you?
Pretty good. So today, before we have you get moving on some of those exercises that I showed you the other day, I'm just going to take your resting heart rate manually, just count the number of beats that I feel in your radial artery, just to make sure that you're not experiencing tachycardia. I know that you've had that issue in the past, and I just want to make sure that your heart is nice and healthy before we get you going on some exercises.
Sounds good.
Okay, so I'm just going to have you relax your arm. I'm going to feel for your radial artery. You can feel a little pulse in there, and I'm going to count it, how many beats that I feel for 30 seconds, and then I'm going to double it to get the number of beats per minute.
Sounds good.
Okay. So I got 31. So we're going to double that, 62 beats per minute, which is within the normal range. So,
Sounds good.
all right, great. Let's get started.
All right.
Hi, Connor.
Hey, Sarah.
How are you doing today?
Good. How are you?
Pretty good. So did you sleep well tonight? Or last night?
I slept all right.
Yeah. So I heard from another provider that you're working with that you've been experiencing some pain post-surgery, and especially at night.
Yeah, I'm trying to sleep.
Okay. So before we get started today, I just want to make sure that you're not in too much pain because we're going to be doing some exercises. I just want to know, what your pain levels are. This is called a visual analog scale. You'll see there's some faces and some numbers, and this scale goes from 10, worst possible pain, and then 0 is no pain. So I just want you to rank based on your subjective experience right now, just before we get started, what your pain level is at this moment. So if you want to take a minute, just look over the numbers and the faces that are associated with each pain level and try to determine which one would best express how you feel right now. And you can mark it yourself.
Alright, I'd say I would probably add about a 5 right now.
Okay. So that's kind of high. Do you feel like you'd be okay participating in activities of, walking around with the walker today?
Yeah, I'd say that'd be okay. Usually after I get it moving a little bit, the pain tends to go away.
Okay, so it's mostly at rest and at nighttime.
Yes, usually at night.
Okay. Yeah, and we can talk about some strategies to help you get a better night's sleep, do some positioning of that knee in good positions to facilitate a restful sleep for you.
Sounds great.
And if you start experiencing pain at any point today, just let me know and we can reconsider what we do.
Okay. Perfect.
Okay, perfect. Thanks so much. Okay, so now we're going to take respiration rate.
Alright.
Just to make sure that your breathing is okay. I'm just going to put my hand on your chest and count the number of times that your chest rises or the number of times that you inhale, and do that for 30 seconds. And then I'm going to multiply the number that I get by 2 to get the number of breaths that you have in a minute.
Makes sense.
Okay. So I'm going to start now. Okay, perfect. So I got 7, and then we're going to multiply that by 2, so 14 breaths per minute, which is totally normal.
Perfect.